I'm Pamela Butler, Child Welfare Policy Manager at Children First for Oregon. The Advocacy organization here in Oregon. We work in 3 areas around focus on kids. So one is keeping kids healthy, the other is keeping kids safe. Last one's strengthening families. So that's anything that lifts families out of poverty, gives services to parents who are struggling. And then I work specifically within the keeping kids safe category, and that is really around child welfare. So doing what we can to make sure kids stay out of the foster care system. If they come in, making sure that the experience doesn't impede future success, and then also for those who are going to age out, giving them the tools they need to do that successfully. So within that category, we have a program called the Oregon Foster Youth Connection that was started in 2008. And it's current and former foster youth who come together, meet monthly, host trainings, do panels like this, speak with caseworkers, all the people involved in the system, just to give their perspective and their stories to help those people do their jobs, better and improve every day and improve their practice. But the other end of what they do and what we do is around changes to public policy. So OFYC has been really successful over the last 3 years. The first year when they talked to the legislature, they got funding for driver's education for kids in foster care. Because up to that point, if you were aging out, you often did it without your driver's license, and then how do you get it once you age out? You don't have money and you can't do driver's ed, it's quite expensive. So youth took that to the Capitol, and there was some funding allotted for foster youth to get driver's education while they're still in care and they have the support of a foster family. Came back in 2010 and expanded health care to age 21. So before that, when you aged out at 18, you lost your foster home, your support system, your caseworker, and you also lost your health care. So then you got put into the pool with all the adults in the state and waited for your lottery to come up so that you could have health insurance, which causes a lot of problems for kids aging out who have chronic illness, who might be seeing a therapist and can't continue with them. So we want to extend that as much as we can, which at the time was up to 21. Because of federal law, in 2014 it'll actually automatically go up to 26, which is really exciting. So foster youth will be allotted the same luxury that kids when they're on their parents' health care get, staying until 26. So then this last year, they came back and said, okay, we'll take care of some health care and some driver's stuff, which is key to independence. What about higher education? We know from numbers, the data, that over 70% of foster youth want to go to college. They have some aspirations to go. But at the end of the day, only about a quarter of them actually try to enter higher ed. And then when all is said and done, by about the age of 25, less than 3% have a bachelor's degree. That's compared to about 19% of the general population. So it wasn't working. And when members talked about what would have been roadblocks to them getting higher ed, one of the big things was financial assistance. So last year we passed a tuition and fee waiver at all state and community colleges here in Oregon. And so that went into effect in January, and this will be the first school year that it's actually going forward. It's a little bit bumpy right now. We're working on changes, but I think it'll be good in the end. So part of what OFYC does outside of the advocacy is comes to panels like this to talk about particular issues. Sometimes it's around transitioning out, sometimes it's specific to caseworkers or judges, but here really the focus is around foster care, mental health, how that gets wrapped up in it, and then also medication and foster care, because for a lot of us, that was an issue. So I'd like my fellow panelists to introduce themselves, and then they can tell you a little bit about their experience with the system.
Okay, hi, my name is Dee Dee. I'm the Vice President of Oregon Foster Youth Connection, and I was in foster care for 20 years, and I just recently aged out last year, so really exciting, but kind of nerve-wracking at the same time. And that's what I'm going to say until he introduces himself.
Hello. Sorry. Hello, my name is David Forker. I am the Secretary of OFYC, and that stands for Oregon Foster Youth Connection. And I am 19 now. I am still currently in foster care, and that's all I'd like to say about that.
Yeah. So what was your guys' experience with the mental health system in foster care?
Well, I was born with a mental disability, and I really don't know really what I could have had happened with that, but they always put me in therapy to see if that would work, and it never really worked. So it kind of sucked that they thought therapy would help a mental disability when it doesn't. So
from my experience, there are a lot of issues out there concerning mental health in the foster care system, and one of those was, for me, I was diagnosed a lot and with all sorts of different diagnoses, but you know, putting a label on something I felt didn't always help the situation. It just, you know, first of all, I was younger and I didn't really know like what it meant, so I used it as a crutch and I didn't even use it right. But I feel I would have, you know, made more success quicker had I been able to just kind of work through the issues and not try to put a label on it all the time, because that's all I ever did in therapy was get labeled. And then they changed the label like every 3 months because they never knew what was wrong. And that's their words, what was wrong, you know? And also another issue was being forced to take medication. I would pretty much have everything taken out of my room and not be able to do anything except for eat, sleep, and, you know, go to school if I didn't take my medication. And yeah, sometimes it was just an issue of the medication would make me have gag reflexes that made me not want to take the medication, yet, you know, I was forced to take it anyway, and I feel that those things would lead to further problems in the future. So those are some issues I have faced in the mental health aspect of foster care.
Yeah, and I don't know how many of you guys were there last night. I talked a little bit about my experience, but when you come into foster care, like the system automatically says you have a mental health problem. And yeah, coming into foster care is traumatic, but it doesn't mean you have some mental health problem that needs to be diagnosed and you need to be medicated and in therapy for the rest of your life. But that is really how they make you feel. Even when you come in and you're 7, you have a problem, you need to talk about it, and they're going to put you in therapy until you confess things, even if they didn't happen to you. And then if you do confess something, you're definitely depressed and you need to be on meds. And every time I went to a therapist, they diagnosed me with something different: depression, dissociative disorder. And I got into college and went to a therapist who decided on the first visit that I'm bipolar because I was in an abusive relationship and having a really rough time. And it just seems to trickle out into all of foster care. And I saw that in my own case, and then definitely of a lot of the kids that I lived with in different homes. I think I mentioned last night that there was one home I was in where there was a little guy, his name was Bubba. He'd been in foster care since he was a baby, born drug addicted. I think he was little, like maybe 5 or 4 when I moved in. We were in the foster home for a long time together, and I watched him progress from just being kind of a normal, quiet little kid to foster mom says that he's ADHD, so they put him on Ritalin. And then he turns into a little vegetable kid. And then foster mom goes to the doctor and says, well, now he's just lazy and he doesn't do anything. What can you do? So then they put him on a different med. And then he starts acting violently and beating the dogs and hitting other kids in the home. So then he gets pulled out of public school and he ends up in an institutionalized school, going there and staying for part of the week. And, you know, he was on the track to be adopted. When all that started, he's no longer on the track to be adopted. You know, kids who have in their file, you know, beats animals, does all these things, they don't really get adopted. So I think his prospects for the future were pretty much ruined because he was getting mixed around on meds that really made him kind of crazy. And I don't blame him for it. He was a little kid. I've heard since then that he's moved to a better place, and through the grapevine he got taken off those meds and is doing really well. But he's older now and never did get adopted, but apparently he's with a pretty good foster family. So he's really lucky that he got with some people who took the time to figure out what he was going through, get him off those meds, and see what he really was like as just a normal little boy. So that was one experience that I saw. I was lucky not to have been forced onto meds by his own system, but mostly just because I was really quiet. You don't need to medicate the quiet ones, you just need to medicate the loud ones, right? Yeah, I mean, that's kind of how the system does it. There's even tips I've read on foster parent blogs about, oh, if the kid comes to your home and they won't stop crying, just give them a bunch of Benadryl and they'll go to sleep. Like, seriously, is this how we're working with people's trauma? Pump them full of meds so they just sleep and you don't have to deal with it? And it's kind of heartbreaking to know that if I had gone into the system and acted like that, that's would have been the answer. Just pump you full of meds.
Yeah, by the time I was 14, I was on 20 different medication for stuff that I didn't even have. Yes, I know I can have a little bit of a short attention span, but that's not a bad thing. And apparently, I'm depressed. I tend to have like all these random things, and I got off of them by one of my parents because I was actually on Ritalin because they thought that I had ADHD, and she weaned me off of it, and then she said, I'll put you back on if I know that after I do this test to see if you are ADHD. She gave me coffee, and with coffee, if you give it to an ADHD kid, they'll calm down, but if the kid doesn't have it, they get hyper. Within like 5 minutes, I was like bouncing off the walls because I was like hyped up on coffee. So she knew I didn't have it, so she didn't put me back on it. But like there were a couple things that I kept on. Like I have asthma, so she kept me with my inhaler, and I have really sensitive skin, so if I get anywhere near grass or like anything with grass, then I break out in hives. So she kept Benadryl around just in case. So.
Was she a nurse? Wasn't she a nurse?
Yeah, she was a registered nurse, and she also she worked to get her naturopathic degree. So she knows the natural stuff to give instead of giving like an aspirin, which is like chalked up with chemicals, compared to white willow bark, which actually helps with headaches and pain.
Did you ever have any experiences with medication?
Yeah, I am on medications right now, actually, but a lot of the medications had side effects which they just medicate me more on different medications for, and that would cause more side effects that were even more different and possibly dangerous. A medication I took approximately 3 years ago still has effects on me today, and I've stopped taking it. As far as I know, it has thinned out my stomach lining to the point of like where when I eat something, I feel like throwing up. I don't always throw up, but I feel like it, and I just feel horrible for the next like half hour or so, and that was 3 years ago.
What medication?
It was I can't remember the medication right now, but it was one, like a combination of medications, and one of them was for, I believe, for like ADHD or something like that, and then another one was for acne. And the combination was just like what caused it, I think.
So did anyone have any questions? We can open it up to that.
I forgot your name.
Dee Dee?
Thanks. You said when you were in counseling it didn't help.
Yeah.
How, if it had helped, what would it have helped you do better?
Well, if it had helped, I probably wouldn't be wanting a relationship with my mom, even though I want one, and even though it's not a good situation, it would have helped me to see like why I see that a different side on that one, and just be able to handle how I interact with people.
I got a little confused. You wish it would have helped you have a relationship with your mom?
Have a better relationship with my mother.
Or a more realistic relationship, would you say?
Yeah.
So, I talked a little bit about this last night, that when I went to therapy many, many years ago, the focus was really on kind of what had happened to me and how I would deal with that, how I would think about things differently or what things meant to me. Did you guys have any therapy that was like that, or what was your therapy when you had talk therapy? What were they really doing? Or how was it framed to you, and what were they seeming to try to accomplish?
The whole time I was in foster care, it seemed like they're just trying to put a label on the issue, put a finger on it, and just kind of work from there. But they could never put a finger on something because, at the time I was a young boy who was, running around in circles because I had just been put on one medication 1 minute, and then the next minute crash because I'm all tired, and then they think that I'm bipolar, and they put me on another medication.
Was it so? But just to add on to that, so was it the parent that was reporting to their doctor to get you on drugs? How was that part done? I mean, how do you actually get to the point where you're being in front of a psych or somebody to prescribe you? Is it the foster parent or school or?
Currently, I live in a program. Actually, it's not necessarily a foster home, but
okay.
It's under the umbrella of foster care.
Right.
And I've been in programs like this for a long time. But there are like group homes. The one I'm in right now is for like youth that are transitional age. But before, when all this was happening, it was just mostly group homes and lockdown facilities, and so their job was pretty much to report any unusual behavior.
So, but what did you do in the session? I know you had to have a session with a therapist that would last, 45 or 50 minutes. What did you actually do?
Most of the time, we just would talk about like what's happened in the past week, and then the last few minutes were like, okay, this is what I'm gonna prescribe you so you don't do it again.
Okay, I think that answers my question. What about you two? Did you have any therapists that were did anything other than talk to you about what happened this week?
Well, with all the therapists I had some therapists who got me just because I apparently am so angry that I need to be in therapy every single week because of anger management. I'm very angry, right?
Yeah.
So they'd always ask me how I was, how my week went, how's my grades in school, that type of stuff, and then after all the like formality questions or whatever they're called finished, they would always ask me, well, what do you remember about being with your your biological parents, and how do you feel about what they did to you, and what do you remember? And it's like, you know what? I don't really care what they did. They did what they did, and it's done. And so then I changed the subject to let's play some board games or let's play some cards because I don't want to focus on the past. So, and that's why I kind of stopped therapy, because they kept going back to the biological family, and it's just like, you're not helping. So.
Did you tell them that?
Yeah.
And it didn't make any difference?
Didn't make any difference. And I told my caseworker that I was 16, and I was like, well, if I have to be in with another therapist, I will ask my attorney to emancipate me, because I don't want to go to therapy anymore because it's not helping me. So she knew that I had a really close relationship with my attorney. So she then quickly stopped the therapy, so I didn't have to go anymore.
Wow. What about you, Pamela? Did you have any therapy?
I didn't have great experiences in therapy. So when I came in foster care, I was 7, and automatically enrolled in therapy. And I think I had a couple therapists, and finally one that I had for a little, I don't know, like some length of time. I was too little to really understand how long I was seeing her. But I'd go every week, and I felt like every session was her trying to get me to say things that people did to me that they didn't do. And they were really stressful. I would go, I would cry because I didn't want to go. You know, I'd beg the foster home not to take me. Court ordered, I'd have to go, so I would go and sit there, and I would just be so stressed out because it was the same question over and over. It was like interrogation over and over until I would say things that happened and draw on a picture and look at this doll and say what your sister did to you. And I was so confused and upset, and this happened over and over and over and over. And like it was all focused on my sister, which was crazy because I loved my sister. We picked on each other. Like I would break her toys, she would break mine. She'd cut a piece of my hair off, so I'd put gum in her hair. You know, things that sisters do, especially when their parents are really dysfunctional. So we came into care, and suddenly the whole focus was on my older sister, and it never really made sense to me. To this day, it doesn't make sense to me. So I hated therapy, like hated it, didn't like to go. And even in my file, I've gone back to look at my file, and there's things that they said, caseworkers wrote in my file, that I directly said to them, which I know I never said because it never happened. So that was a really bad way for me to start. It wasn't about what happened in your house, how was it growing up, you know, what was it like to be homeless all the time and live in shelters and not have clothes that fit you and not eat some days. It wasn't about that. It was all about my sister and how did she touch me and how did she do this and did she do that, and drawing pictures about how I felt about her. So that, I think, really was not very helpful. And so finally one day I came into therapy. This was after, like, I think I was in care for, I don't know, a few years at this point, and I was crying, and she's like, oh, you're finally ready to tell me what your sister did to you. And I was like, and I burst out with all this abuse that actually been happening in my foster homes. Like how, like, it's a long story about the stuff that happened there, but parents were alcoholics, and we were treated like slaves, and, you know, some of the kids got beat, and you got locked outside if you were bad, and you had to mow the lawn with scissors because, whatever, you weren't allowed to use a mower because you're a foster kid, so you have to do it with scissors, right? So I confessed all these things, and then I never see that therapist again. That was the last time I saw her, and by the time I got home to a foster home, they had already called my foster mom and told her everything I said. So I spent the next, like, 3 years on complete lockdown in that home, under severe restriction and manipulation and torture, and they cut off visits with my mom for a while. They wouldn't let me see my sister. It was really awful. So then, by the time they sent me to another therapist, I was like, you know, I think I was in middle school at that point. And this is a therapist who told me that I was never actually going to be truly happy because I wouldn't admit that I was unhappy. So clearly I had something wrong with me, and then if I didn't admit that and get on meds, then I was never going to be happy in my whole life. I was never going to experience happiness. And so I think I went to her like 3 or 4 times, and then I came back, and at that point I'd gotten a CASA, and I told her, I don't care what the judge says. Next time you go see the judge, you tell him I'm never going back to therapy, ever, ever again. And she did, and I never had to go again. So I had a really bad taste in my mouth from therapists. And they were always, every visit, talking about meds and how good they were and how they might help me, even though I wasn't really depressed. But I just had this, my mom, you know, had a drug problem, my sister had a drug problem, runs in my family, so meds to me was another connection of bad, addictive drugs. So I was really against it. Like, no, I won't take them, I won't take them, I won't take them. So when I got done with foster care, I waited a couple years and have started going back to therapy and haven't had the best experiences either. But I'm trying to find someone who's going to do good work with me. But yeah, there's some crazies out there.
I have a question. I hope we didn't.
Nope.
You all seem to have kind of, navigated the system somehow and come out in a positive place. Unfortunately, a lot of children don't. So what would you say is the saving thing in your life that gave you that ability? What if something happened, somebody who was there for you, whatever, your own kind of personal strength, what would you say helped you to navigate it and come out to a positive place? If that's where you identify yourself as being.
Well, I had this really, I call them the perfect family that I had, because the moment I moved in, the first thing they told me was that I'm their child and that they love me, and it's the first time I was ever told that, you know, I love you by anybody besides my sister, but that technically doesn't count because we know we love each other no matter what.
She's required.
It's not really a required love, but it's more of a, I know that it's their kind of thing from her. So, and I had moved into their house December 24th, so the day before Christmas, and I got like the unconditional love through thick and thin. If I was being a brat, they would be like, oh, get over yourself, you know. And I lived with them for 3.5 years, and I still go back to their house for most holidays to celebrate with them. So, and they always told me, you're not going to turn out like your mom or your parents, because you now have a family that loves you and wants you to succeed. So me and my sister are the first generation to graduate from high school, and we're also, even though I'm kind of taking a break right now from college, because I found out that I'm allergic to dogs, and going into the veterinarian program didn't really work. So I'm going to be going into the other side of the medical field and work with people. And so me and my sister are going to be the first generation to graduate from college in our family.
So just a little bit of background information. I started in foster care when I was about 12, and what happened was I was taken out of my house on, it was actually a few days before Christmas, just like you're putting that family, like the day before Christmas. So it reminded me of this. So, you know, because I was taken out of my family, and it was like such an emotional time of the year, and then all the things that have happened since then, I went on a downward spiral for a while, and I felt hopeless for a while and didn't know what to do, and started acting out for a while, whether that was due to the medications or the therapy or the just lack of hope, I don't know. But when I finally got to rock bottom, I decided I did not like who I was being and what was happening to me, and I wanted to change, but I needed something to help me change. And that was when I got involved with places such as OFYC, or Youth Move is another one I am involved with. And Youth Move was actually the first one I was involved with at first, and it opened up a lot of doors for me, and just being able to advocate for people and be with people like me, and, you know, understand my issues, you know, big or small, really helped me out. And there was also the fact that I got a service called Wraparound that came into effect when I was just moving out of a lockdown facility. And what they do is that they're therapists that are specific, well, not therapists, but coordinators that are specifically trained to be strengths-based, and they work with you where you're at to become a transitional age adult, and then from there transition out. And I think it was a combination of all that that really helped me to become successful and be the person that I am today, and be someone that's going to be successful in the future.
Do you mind just repeating what they're called, Wraparound? Is that the organization that you're talking about?
Yeah, that's Wraparound. It's a organization that is trying to implement a system of care in Oregon. They just had a summit recently, about a week and a half ago, and it's similar to, like, if you go to, like, for example, I'm from Washington County, and I had Washington County Mental Health as my health coordinator, who would hook me up with, like, the therapy and the medication management and just similar aspects of foster care. but when wraparound came into effect, they got wraparound workers at Washington County Mental Health, and they took over for my coordinator because I was one of the very few that actually were recommended to be in the program, and I think it's really important that they got involved in my life because they operate on a set of principles that I believe are very important, such as youth and family driven. That's one of my favorite ones that they do. And so that's just a little bit about wraparound though.
Thank you.
And I think it's an initiative, right, that's been piloted in some communities, but it's not statewide yet.
Yeah.
But it sounds like it's been really successful.
But now you're 19, so you're not with wraparound now.
I'm with wraparound until I transition out, which will be sometime this summer.
So who's part of your support system now, like your mental health and things?
I have a wraparound worker and I have a DHS worker. I also have some people from the program I live in that are on my treatment team, and a therapist and medication management person.
So you're still involved with wraparound,
Yeah.
even though you're 19?
Yeah. They don't leave you until it's time for you to transition out, and then you can open a voluntary case with them for a temporary period of time until you're officially like done with DHS completely.
Oh, that's
Yeah.
helpful.
A lot of those services can go up to 21, which is awesome.
Yeah.
Can you share your experience similar to what helped you?
Yeah. Well, for the bulk of care, really what I had was school. That's a place where we just had a conversation about this last night, where you know what the rules are, and you know what to do to get the gold star, and you know what to do to, keep everything running smoothly. So for a lot of the time, it was really just school, because I didn't have great foster parents. I really had not very great caseworkers. The therapists you've already heard about. It's really surrounded by a whole host of adults who I despised and I didn't trust. And they just reaffirmed it over and over and over and over again. So I actually didn't really get good support people until I was a teenager. So when I was about to turn 15, I had just been put in my first good foster home with this family who was a friend of mine I had known for a long time. And the parents took me in, they got certified just for me. And I was really loving it. I was there for maybe 8 months, and then the judge decided to send me home. So at that point, they gave me a CASA, a court-appointed special advocate, because suddenly I apparently needed a voice. They decided after 8 years in foster care that they'd give me a CASA. So she came in right at that point when I was being sent home. And so she came in kind of a mess. Because the foster family I was with was actually willing to adopt me. But for some reason the judge wanted me to make a go at it at home, even though I'd been gone for 8 years. Nothing had changed. And my mom had actually had 2 more children while I was gone who were also being neglected. So I got sent home. The only thing that changed is I'd gotten older. Got sent home, the CASA got put in my life. At first, it was just another adult, another person in the state sent to come make me answer questions, and then they'd disappear. And so I was annoyed, really. I didn't want another person to have to repeat everything, too. But she stuck around, When I got sent home, she was there. She came every week. She brought me, news clippings about kids who had made it through really tough situations and gone off to school. And that was probably the hardest time in my life. When we talk about depression, that was the bottom of the barrel. I was not eating. My caseworker came to take me to my mom's and had to actually physically drag me out of the foster home because I had woven myself under the bed and the wires of the bedding and was holding on for dear life. And she actually was threatening that if I didn't come with her, that she would send the cops back for me and then I'd be in juvenile hall. So finally my foster mom convinced me to go with her because she's like, don't worry, we'll get you back soon. You'll just have to go for a little while. And since I didn't want to stay at my mom's, I refused to pack any clothes. It was actually my pajamas. And I had a broken leg at the time, so I was on crutches. So I got sent home, and my mom didn't live. She lived pretty grossly, like an apartment covered in garbage and poop diapers and fecal stuff stuffed in the floor and dirty dishes and cockroaches and mice. It was disgusting. And so I made my little pathway to my room and shut the door and didn't open it for like 2 weeks. I didn't eat food and I didn't let her in, and every time she came to the door I just screamed at her, and I was to the point where I was just like banging my head into the wall. And I can't even recognize the person that I was then for who I am today. It was a really, really scary time. So my CASA would come and she would weave through piles of stuff and sit in my room, the only clean place in the house, and we would talk. And she made me go see a therapist, which I think the last visit I had with that, I actually had to leave my therapist because this one was actually decent, because when I moved in with my mom, she was not in my district anymore or whatever, so then I had to leave her in the middle of this transition home with my mom. So my CASA was the only person at this point then who's consistent, because the court wouldn't let my foster family come visit me because they wanted me to, get to know my mom more and not think I'm going home with them. So the foster family wasn't able to see me. I wasn't able to go visit them. I didn't know what was going on. We had a phone in the house, but my mom didn't want me to use it. So my CASA was the only person I had, like, through this period of time. And so I transitioned. I started to feel better. She was like, you can't let this be the end of your life. You're going to get out of here. You're almost 15. Only a few years you have to deal with this, and then you'll be out, and you can do whatever you want with the rest of your life. Just don't let go now. Just don't let go. And that was, it was hard. But she cheered for me and brought me books and kind of coaxed me out of the house and encouraged me to get involved in school, because at that point that was my first year going into high school. And just told me, put all your energy in school, just focus on that, and you'll get out of here soon. And I did, and things turned around, and it didn't work out with my mom. I ended up going back into foster care, but my CASA was there the whole time. She advocated for me. By that point, I was so fed up with the system that I literally said, I don't want any calls from caseworkers, lawyers, judges, or anybody. I'm not going to a hearing ever again. I'm not going to therapy. I really need you to take care of all that. I just want to be a normal kid for my last 2 years of high school. And she did. She took care of it all. I didn't have to go to anything. Didn't have to hear from anybody. I did have to talk to my caseworker every now and then. I actually got a really good caseworker the last 8 months of my case, and so I didn't mind talking to her. But if it wasn't for her, I really don't know what would have happened. I think that period of being sent home with my mom, I think it would have just been the last straw that breaks the camel's back. So I attribute a lot of my success to her. Yeah, court-appointed special advocates. It's the program that Steve works for.
Thank you.
And they're volunteers that are appointed to a case, and they have a legal responsibility on the case to report to the judge, and they're supposed to be the voice for the child and advocate for what the child wants, and knowing all the pieces of the case, which is not often what a lawyer has time to do. So the CASA is supposed to know your teachers, your foster parents, your bio parents, your siblings, your friends, and have the full picture of what your life is like, and then advocate on your behalf based on all that knowledge, because it's filling a niche in the system, because there's no one who has time or the ability to do that in a case. And so they come in and they really become your advocate. So they're amazing.
And it's a volunteer position?
Mm-hmm. Yeah, they're volunteers.
Professional staff who supervise them, which is what I do. But the people who actually do the legwork are volunteers, and they're not particularly trained in social work. In fact, part of the model is that we want citizens who don't necessarily know anything about the system, because then they come with an open mind and look at the situation and say, okay, so why are you returning her home? And she seems to be locked in her room, and there's piles of crap outside. Does that really seem like a healthy environment for a child? They are willing to question things that I think social workers that have done it for a long time stop questioning, because it's the system and we all know how it works.
Yeah, and actually when I got sent home, my CASA was the only one who was like, I don't think this is a good idea. She was the only one in the courtroom who stood up. Everyone else was like, meh. She's 14, she can take care of herself. So they sent me home. But they didn't have to deal with the fallout. Long answer.
Thank you very much.
So you painted a, not to me, very surprising, but very discouraging picture of the mental health system and what it has offered you. I'm not hearing really any of you saying that you've gotten anything significant as foster kids out of the mental health system. What do you think would make it better? What do you think what would you have needed from a therapist or counselor that would have helped you deal with the situation?
Well, for me, is having a therapist or anybody that, basically just the therapist, talk to me as a normal human being, and to not be like, oh, I know what happened to your past because I happen to be talking with your caseworker and she tells me all this stuff, which
She sent me your file.
I would like for therapists to, if they get a file, to not think that all of it's true, because it's not all true. Just to kind of go over it and be like, well, I heard that this happened. Is it true? What happened? What's your take on it? And that type of stuff, and not exactly be going straight into the, like for me, like going straight to the, what did your parents do, and let's talk about it, let's make you feel better type of thing. So if they can just work their way around it and make a youth feel better about the relationship between them, it would be a lot better.
I feel that it would be beneficial if the file that we get sent to a therapist was more open and accessible to us, because it's like they'll pick something out of there that they find particularly alarming, and I know nothing about it, and they try to work on it without telling me what the issue that they're alarmed by is. So, and that frustrates me. I know my file fills up 3 binders, but and I'm talking about the 2-inch binders, but still, I mean, share something with me at least.
Yeah, so what can therapists do that's better? Well, now that I've aged out of the system, I work on the other end as an advocate, I know a little bit more about how it all works, and I know that unfortunately the state usually sends the most traumatized and at-risk youth to therapists who maybe are very new, they haven't been around for a long time, they don't specialize in child abuse and trauma, they are, they're so fresh out of the box that they're not really helpful, and often maybe even detrimental to foster youth, because we need the best of the best. They're going to help guide us through some really, really hard times. And right now the system doesn't offer you that. The system offers you the newbies who, I'm sure there are some that are amazing, they come out and they've just got the gift, but I don't feel like a lot of people have that gift. And so the foster youth get sent to these people who are less than adequately prepared to deal with the situations we've experienced. And I know for me, the whole file thing was a huge trust issue, and I go back to spending months and months and months with a therapist trying to convince me that my sister sexually abused me when she didn't. And I will never forget that. And it was really harmful to our relationship. They really tried to demonize her to me, and it was so mind-boggling. Even today, I have trouble even wrapping my head around where that all came from. But so being open and honest, and then having people with some history, some knowledge, some tools, someone who's not just learning, because these are not the kids who you test people out on. That's a life or death thing if you're not prepared to help guide a youth. And the other thing is assuming that you're just screwed up because you're in foster care. Clearly there's something completely wrong with you and I'm going to fix you. That right there, you just put up a big wall. Boom. Our relationship is not even started because you're assuming I'm screwed up and you're going to fix me. Because although I knew I was struggling with things and I knew I was sad, I didn't think I was permanently damaged. And I definitely didn't think some idiot I just met is going to fix me. So that was really hard when people literally say, like, I'm going to save you, or I need to save you, or fix you, or, like, wait, why do I need fixing, and who in the hell are you? You don't know what I've been through. Yeah.
What would be a better message than you're messed up and unfinished? What would be a good message for a counselor or other person trying to be helpful?
Well, you say, sounds like you've been through a lot. Must really suck. What do we need, what do you want to talk about? And then going, highlighting things in the file. Your file says these few things. Did that really happen? How did you feel about that? I think you go in and there's so many assumptions that they already have and they're already working on this thing and you're just confused. And maybe that's not something you even have a problem with, or maybe it didn't happen. And so there's this thing you really want to talk about, like, hey, I'm being abused in foster care, but you just spent 8 months talking about something that never happened to you. So I think just being more like open. Yeah, the system is pretty messed up. It's going to be hard while you're in here. I get it. You have to come to counseling. It's mandated by your judge, and I know that. But what can we do in here that's going to help you get through your days in foster care? And just put it like that. How can I help you get through the next week in your foster home? And I think that could build a relationship that could then maybe lead to other work on other issues. Any other questions?
You mentioned that you're on medicine now. How do you feel about what you're on now? Is it working the way you want it to help you?
Well, I am on a few medications that are more mental health related than like acne medications or something, and I really don't like medications at all, just because of all the effects that have happened on me. But the thing that's helped me out to deal with these medications is just the fact that I'm starting to wean off of them, and I'm on a very low dose. Like they call it a maintenance dose, is what the lowest you can be on where it's still effective, and I'm actually below that on 2 of my medications, and doing well still. So I am thinking maybe someday soon we'll be able to take me off completely. I just don't know why it hasn't happened already, but I feel that medications never solve the issue. They just kind of bury it. And so, that's what I'm trying to do right now, is get off the medications.
And do you feel like the support system that you have is in place sufficiently to help you do that if there are any problems that come up for you?
Yeah, mostly it's just the fact that my treatment team is in very close communication with each other. We meet once a month, but we talk way more than that. All of us, I'll talk to my caseworker, and my caseworker will talk to my dad, and my dad will talk to my mental health worker, and all the information we need to know gets around somehow. And I think it's very efficient the way that they deal with the problems that come up. So I think that it's a very good safety net.
Do you mind sharing where you live, the name of where you live?
Sure. It's the Inn Home for Boys. It's in Portland here.
Inn Home?
Yeah, INN.
Oh, and you're pretty happy with it?
Yeah, it's pretty good.
And what age does it go to?
I believe it goes until maybe. I think it's just when you age out. You can be there until you age out, providing that you're not there for more than 1.5 years. That's why I have to move out this summer, is because this summer will have been 1.5 years.
Oh, and where are you going to go then?
There's an apartment that they have out back that is for youth on subsidy, which is a housing grant, I guess you could say. Mm-hmm. And I will be out there on subsidy for a while, and then once I get comfortable enough to move out into a real apartment, I can do that. And then once the subsidy's over, then I can be on Chafee housing. Chafee housing, which is another housing grant, and it's for youth not in foster care anymore, like former foster youth. So you have to have been in foster care for a while, I believe, At least that's the only way I've ever heard of people being on Chafee housing. But you can't be in DHS care, I don't believe. Subsidy you can though. Subsidy you're still in DHS care, but you know you're as soon as you're on subsidy, and I think you get a year on subsidy. Then as soon as the year's up, you're out of DHS for good.
Yeah.
And what did you say you do in the rest of your life? Are you in school?
Yeah, I'm going to Portland Community College right now.
Which grade?
Well, I go to Southeast Center, and I also go to Cascade campus. Yeah.
Any questions? I think we've got a few more minutes left. You want to tell them what you're doing now, Dee Dee?
What do you mean by that?
Your housing, you got into a great place, your school plans.
Oh, well, I was homeless for about like 2 months. Granted, it was really, I wasn't living like under a bridge. I was living with different members within my church that I am attending. And so I got into this good place called the Patent Home, and it helps people who can't afford like an apartment or a house, and it's low income housing, low income apartments, I guess. And I'm going to be going back to school in the fall to get an LPN degree, which is licensed practical nurse. Let's just hope that I'm not allergic to anything there. But yeah, I want to eventually get to the point where I'm the head doctor of an ER. That's a good goal to go towards. So, because I don't think I want to do surgery, because I would probably be one of those doctors that just explore, and I don't want to, I know that I would probably do that, so I don't think it would be the best option for me to do that. So just being the head doctor would be good, or just like a doctor generally in the ER.
So you're in school for another 20 years, right? That's a lot of schooling.
Well, to become a doctor, it takes 8 years, but because I'm going to LPN first, it's going to take like 2-3 years to do that. And that includes getting like the prereqs and stuff done.
I have a question. I was talking to these adults earlier today, and I was asking about children of color, and there seems to be not a lot that are getting involved, and is there reasons? Do you understand that? And is there a way that, like as part of the moms movement or something, might hook them in? Because it sounds like it's a very empowering program. And I'm just curious, what's your thoughts on that?
So you mean getting involved in like advocacy or kind of that kind of stuff?
So that like in the programs like this that are empowering programs, that there would be more children of color. Because, and you know, proportionately there are far more children of color in the system taken out of their homes.
Yeah, the data says that kids of color come into care more often, stay in care longer, and age out more often than, white Caucasian kids. So as far as involvement in like advocacy groups, particularly OFYC, we do have members who are African American. At one point had some that were Latino, but for some reason, I've spoken with representatives from Native American Youth Association, Youth Center. I can't think of the acronym. They've been really, what the director said to me is they've been really burned by committees or this thing or that thing coming and saying, oh, we want to involve your youth, and then they really get tokenized, taken advantage of. And so I think that's what's kind of happened up until this point, that kids of color have been burned and tokenized, and so there's a lot of resistance to come into something like this. But we're hoping that that'll start to change, especially with OFYC, because OFYC is youth-driven, youth-led. The youth pick the times, the places, the meetings, do all the work, create their own speeches, pick their policy agenda, what issues they want to work on. So I think over time, they might begin to see that at least OFYC and Youth Move is not like that. But I think overall, the system really, DHS workers or whoever agencies, organizations have in the past kind of tokenized. And it's not just youth of color, but foster youth in general. And so we're trying to move away from that. And OFYC is like, we do not engage in organizations who are going to tokenize the members or let anyone actually come in and do anything that's like that. So I'm hoping that it'll begin to change and foster youth and kids of color begin to come around and want to be engaged and see that their voice will be heard equally and as loudly as everyone else is. But I really think that up until this point, there's been too much of the tokenizing and kind of taking advantage of kids. So, but I would love to have a conversation with you about how we could bring in youth and partner with other organizations to get the communities of color involved. Yeah. Anything else? No? Well, thank you.
Thank you.
For coming. Yeah. So we've got a couple minutes. I'm wondering who's